Hello everyone, welcome. Shall we? Oh, it's still going. Is it finished, Lucinda? Or is it?
There is another 50 seconds.
Oh, go for it. Sorry, apologies. Right. So sorry for my rude interruption there. It went quiet, and I thought it'd come to its natural end. So I welcome everybody for turning up today for this session on joy in work. Just by a way of a quick introduction, I am Julia Wood, and I'm one of the conveners for the Improving Joy in Work Q Community Special Interest Group. So we really do have a fantastic session for you today. But just before we start, I just wanted to share with you some general information about the event and also some information about the Q community. So I'll just start off with some general information. So as you know, this event will last an hour. You will have noted that this event is being recorded and it will be hosted on the Q community YouTube channel. Because you've registered for this event, you will be sent the link in a follow-up email once that's been uploaded onto YouTube. What we will do, and what you've probably noticed, is I have been putting people on mute as you've been joining today, and that will continue while the presenters are delivering their presentation. But what I would say is if you do have any questions, please do add them into the chat. So these will be answered either during the presentation or we'll pick them up at the end of the presentation. So, but do ask your questions. We do want to hear what questions you have. Now, just a few words about the Q community itself. So, if Q is completely new to you, Q is delivered by the Health Foundation and supported and co-funded by partners across UK and Ireland. So Q is all about connecting people who have an interest in quality improvement, and currently there's about 4,000 members and that membership continues to grow, so it's brilliant. And what I don't have time to do today is to go into all the benefits of being a Q member. So you will really just have to take my word for it that there are many. But for me, I do have to say one of the key benefits is that it has provided me with an opportunity to meet like-minded people from across the UK and Ireland who I would never otherwise have ever had the opportunity to meet. And of course, I've also had the opportunity to get involved in some really interesting stuff. So with Q, the more you put into it, I would definitely say the more you get out of it. And the last point I wanted to make is that being a member is completely free. So all you have to do is apply. So it's definitely worth doing. So if you're not a member, I would strongly suggest that you look into this further. And I'm going to put two links in the chat. So one is just the website for the Q community and the other is the join in link. So, but now we're going to move on to the main event. So I am absolutely delighted to introduce Lucinda, Liz and Bridget today, who are going to share their collaborative approach to joy in work, which has been taken by the Central London Community Healthcare Trust. So I'm going to hand over to you now. Thank you.
Thanks. So we'll just start off with some introductions. So my name is Bridget Brown. I'm an improvement advisor at Central and North West London NHS Foundation Trust, but at the start of this collaborative, I was a senior improvement facilitator at Central London Community Health. If I was to reflect on one thing that's brought me joy in work over the last week, I had a welcome pack to a development course that I've been waiting for a number of years. So that's brought me great joy this week. And I'm going to hand over to Liz to introduce herself.
Hello, my name is Liz Loughton. I'm a locality lead speech and language therapist in early years for Central London Community Healthcare Trust. I had a think about my joy at work moment, and yesterday I was in clinic working with a little boy who's got social communication differences, and he was becoming really annoyed because he couldn't do something. And I said to him, yes, this is really frustrating. And he stopped what he was doing and he looked at me and he smiled like, oh, you really got it. And that was just a really kind of lovely kind of magic moment. So that was great for me.
And I'm Lucinda, or Lou for short. I'm the Senior Improvement Facilitator at CLCH, I'm going to say for short. So I took over the collaborative, if you like, when Bridget left. So the way we're going to do this presentation is Bridget will speak about the run up to the collaborative and the setup and the start, and then I'll take over to talk about what happened and the ending. Back to you, Bridget. Oh, and my joy and work moment, I forgot about that. My moment of joy was yesterday when I received some really lovely feedback about a member of staff who I line manage. So it's always, it made me feel very proud. It's always good to hear good feedback about your team.
Thanks, Lou. So if you could just let us know today how you're feeling. Are you happy, sad, angry, worried, shy, excited? If you can just chat and let us know as a bit of an icebreaker, but also just to help us get a sense of how everyone's feeling. And whilst you do that, we're just going to talk through really how we would like to run the session. We would like it to be interactive, so we are happy to take questions, so do feel free to raise your hands. If we can't take them in the moment, we'll come back to them at the end. We will have some time for that. Do feel free to chat in. Lou and I will try our best to answer the questions as they come up in the chat. And I'm very glad to see we have lots of happy people on the call today, so that's good. So before we start, we just wanted to thank a few people because we recognise that it takes a community to raise a collaborative. So we'd like to thank the QI team at CLCH and the shared governance team, our QI community and our network of improvers who were absolutely vital in giving us the information that we needed and the support to start this collaborative. So this special interest group being one of them, and who were extremely generous with their knowledge, and Elizabeth Hale, who's the Director of Improvement at CLCH, and Billy Hatafani, who endorsed and supported us from a leadership level. So Billy is the Deputy Chief Nurse for CLCH. So just a little bit of background. So CLCH, for those who don't know it, is a large community health trust that provide healthcare across 7 London boroughs and Hertfordshire and have approximately 4,000 staff members. They had a QI team in place, which at the start of 2020 was 3 staff members. So there was real desire to expand quality improvement capability and capacity in the trust. And there was approval in early 2020 to expand the team. So 2020 started with 3 staff members in the QI team and ended with 12 staff members in the QI team. So large investment and expansion of QI in 2020, which coincided with a pandemic. So suddenly we had a large team who had a real challenge of how do you build QI capability and capacity in the midst of a pandemic in a really difficult time for teams. And many of the QI team members were redeployed as soon as they started their jobs, but some team members were out in services trying to support improvement. and they were reporting anecdotal evidence that all conversations were leading to well-being. So the facilitators would be out talking to teams, say, for example, about improving IPC and the use of wearing of masks in the service in response to the pandemic, and the conversations would lead to this real desire to just want to be able to have a cup of tea and cake with colleagues, or they'd be working with teams to start to look at how they could manage their expanding wait lists, and it would move to a conversation around we just really miss being able to connect with each other over the desk and have those conversations where we can bounce ideas back and forth about our patients and just about our day. So there was a real sense coming from the team that they felt that every conversation they had was leading to sort of conversations around well-being. So we knew that there was something there. And then if we sort of started to look at the data to back up this anecdotal feeling that the staff were reporting, the staff survey results showed very clearly that there were 3 priority areas for the trust, and those were health and well-being, morale, and team working. So those elements led to this idea of a joy and work collaborative. So what you have up here on the screen is the framework for joy and work. I'm not going to go into it in too much detail. If it may well be something that you are familiar with, but if you're not, if you just Google IHI joy and work framework, it will come up as probably the first link. But what the framework has are these different elements that are critical components to ensuring a joyful and engaged workforce. And it recognizes that these are interlocking responsibilities at different levels of the organization. So you have some elements of joy that are sort of the responsibility of senior leaders. So we've got physical and psychological safety. We've got work has meaning and purpose, autonomy and control. So some ability to have autonomy and control over your working day, and recognition and rewards. And then there's some elements that are for managers and core leaders, such as participative management and teamwork and camaraderie. And then there's a recognition that there are some elements that are up to individuals or at team level, for example, real-time measurement, self-care around wellness and resilience, but also this idea of using daily improvements, so QI methodology to bring joy in work. So following discussion with the team and our QI program board, we proposed the idea of running an improvement collaborative using this framework. In principle, the idea was fairly simple. The collaborative would be shared through a variety of channels, and teams would put themselves forward to be a part of the collaborative. The only requirement was that they needed to have a sponsor at a local level, so a senior sponsor, a senior leader who endorsed the team being a part of the collaborative and was willing to sign up to the framework as an approach locally. We weren't overly ambitious. We were quite happy with the idea that if it was 5 teams, we could call it a collaborative. But what we had in the end, and Lou will go into this in more details, we had 21 teams sign up to be a part of the collaborative. The framework has these 5 critical points, so physical and psychological safety, purpose and meaning of work is appreciated, some choice and control over the way my time is spent at work, and that might be as simple as having the ability to make a case for change, camaraderie with colleagues, and that work life is considered to be fair and equitable. In the early days of planning, we met with Amy Cruikshank, who had been part of a Joy and Work collaborative at Royal Free, and she shared with us these 4 steps to joy, which come out the framework. So the first one is ask staff what matters to you. The second one, identify unique impediments to joy in the local context, and they had framed this as asking the question of what are the pebbles in your shoes, which we shamelessly stole. So we used that as a question we would ask team members on the collaborative, what are the pebbles in your shoes? This third step is a commitment to a systems approach to making joy at work a shared responsibility at all levels of the organisation. And I'm going to come back to this one, but the fourth one is use improvement science to test approaches to improving joy at work in your organization. So when we looked at this, we thought this is all pretty straightforward, and we've got this around, we can ask staff what matters to them, we can ask the pebbles in their shoes, we know improvement science as a quality improvement team, but we did have some concerns around this third step of a commitment to a systems approach to making joy in work a shared responsibility at all levels of the organization, because absolutely there was a commitment to well-being, but not necessarily the entire organization was signed up to the framework. So I'll be honest, there was a slight concern that we might be opening a little bit of a can of worms. So we tried our best to think about how could we mitigate that, and how could we make sure that we're making sure that teams that took part in this collaborative were supported. So we looked at core support, and that's basic and in-depth QI training and training on the Joy in Work framework. We arranged QI coaching sessions for any teams that took part. They had QI coaches from the improvement team, and the first cohort of QI coaches CLCH trained supported them. And we had collaborative workshops. And then we looked at other enablers that sat around the collaborative. So CLCH have a shared governance approach. I'm not going to go into the detail of that, but what that means is that there is a support, the shared governance team support bottom-up improvement, and there's also an allocation of time to be able to undertake improvement using the shared governance approach. So we knew that if we joined forces with shared governance, there would be real bottom-up improvement, but also some time allocated for this. So we joined forces with shared governance. All project teams had project sponsors, and those sponsors were given guides around and some brief introduction to the Joy in Work framework, and they were given guides around how to be a sponsor, so types of conversations to have as an improvement sponsor. As I mentioned already, we had executive sponsorship. We had sponsorship from Elizabeth Hale as Director of Improvement, who was the overall sponsor for the collaborative. We had leadership representation at collaborative workshops to show that we had support from leadership in the organisation. So Billy Hattifani, I mentioned earlier, joined one of the workshops to co-present with us. We used Life QI as a platform to log the improvement work, and we tapped into existing governance channels. So we didn't create something that was separate for Joy in Work. We used existing governance channels to report this work into. And then we set up these collaborative workshops. I'm not going to go into too much detail. Lou will talk about that later. But we set a requirement. It didn't always happen in practice, but we requested that a minimum of 3 people from each team joined. And that would mean that someone joining the Joy in Work collaborative wasn't a standalone person who was then coming back into a team and talking about Joy in Work alone. They would have some support from their colleagues who were also part of the collaborative. So we started off by asking those questions. So for those who joined, you may have seen the little video that we played at the beginning that was formed from these questions that we asked. So once we had the teams in the room, we asked the question, what matters to you? And we found that there was a sense that the most important things coming through for staff were relationships with colleagues and feeling valued and appreciated in their day-to-day work. And we started straight away to see some common themes around support, development, communication, respect, and a sense of purpose in the context of their local environment. When we asked what are the pebbles in your shoes, we talked a lot initially about the difference between pebbles and boulders. So we made this I suppose we made the differentiation between pebbles being things that you had control over and boulders being the things that you had no control over and can't change. And in this question, we saw some elements that we expected to see, and the standout ones here are linked to a feeling of burnout, capacity, workload, time. IT, that came up somewhere there. It's obviously a common issue across many trusts and probably sat more in the boulders category. But we also started to see some other elements such as wait lists, declined appointments, incomplete referrals, feeling of isolation, parking difficulties, so some things that could potentially quite easily be looked at, and work environments. So now I'm going to hand over to Lou, who's going to talk to you a little bit about the projects that came out of the collaborative.
Thank you, Bridget. Yeah, so when we look at the projects that came out of the collaborative and how they mapped the framework, it was very clear that they came under 3 areas in particular. So those 3 areas are the bigger orange arrows. So wellness and resilience. So we had teams with aims to simply improve health and well-being in their teams, daily improvements. So this, for example, could be teams who wanted to improve certain systems or processes that they worked with and within on a daily basis. Camaraderie and teamwork. So a number of teams specifically looked at improving how they worked together, how they communicated, and how connected they felt. And I think what came out almost as a byproduct, if you like, is psychological safety. And one of the teams in particular who spoke at our CLCH conference last week talked really well about how, even though their project wasn't necessarily around psychological safety, just going through, and actually Bridget, you mentioned them, just by going through the collaborative and working together, they developed psychological safety within the team. So I think when I first looked at the framework, one of my concerns was how were we going to address psychological safety, and what we know now is that it can come out of teams working together through an improvement collaborative. So I just want to spend some time talking about an overview of the improvement collaborative and the structure. We did base it on breakthrough series collaboratives, but it's not a breakthrough series collaborative because we didn't have a change package for teams to test. This is the first time we did anything like this in the trust. So we delivered the collaborative over 6 months. So you can see it started in June and ended in December. We delivered it entirely virtually because of the pandemic, and we are going to repeat it this year, and we're going to have a mixture of in-person and virtual this time. I think something worth knowing is how long it took to plan and lead into the collaborative. So we had a 3-month lead-in time, and it definitely required that 3-month leading time to communicate about the collaborative, to get teams on board, to get teams signed up. So the first learning set was just 90 minutes introduction, and then learning sets 2 and 3 were really important. As you can see, they were full days, and that's where we did the majority of teaching on QI methodology, and we helped every team set up their join work project. So by the 20th of July, every team had a SMART aim, a driver diagram. They knew roughly what measures they were going to be looking at and collecting. So in that sense, we front loaded the collaborative, and it did coincide with summer. So we had no sessions over August, but it worked quite well because it meant that when we came back in September, we went into some more theory about measurement and run charts, and teams had some time to collect some data since July, so they could start working with it. And then the rest of the learning sets, I mean, really September, October, November, what was really important there was the sharing and learning. So we spent a lot of time in breakout rooms, hearing from teams and how they're doing, and tried to mix up the teams as well, so they heard from different people. We made sure there was networking throughout the whole of the collaborative, and it was all virtual, so all through breakout rooms. And at the end in December, we had a celebration event. So I think it's important to say that even though there was no team that got to the celebration event with a completed QI project, every team was still working on their projects, but we celebrated their work so far and their efforts and their learning, and it was a really enjoyable event that we ran for 90 minutes, and we had some of the executive team there as well, and I'll talk about that in a moment. The other thing about the structure of the collaborative is every project team had a coach, an improvement coach, to support them in between learning sets to progress their QI project work. You can see there that in between learning sets, the PDSA cycles, so the focus was on action and support from their coaches. Just thinking if there's anything else you should. Oh yes, I've got something animated here. So it's quite interesting to see how many teams we started with and how many teams we ended with. So we started with 21 teams or 85 staff, and of course we didn't finish with all of those people. We finished with 13 teams and 57 staff who finished the collaborative, and they also got QI practitioner certification, which is part of our training levels here at CLCH. The reason that some of the teams couldn't end were always down to caseloads, or perhaps due to staff turnover. So key staff within the project team who are moving on to other roles. So we didn't mind that too much. We knew that we would probably lose about a third of people, and that is what we saw in reality. We did have a few teams drop out who said they would still like to work on their particular project, but at a later date, and they did pick up their projects after the collaborative ended with improvement coaches, and perhaps some of them will join this June when we launch our second collaborative. Let's move on. So I just wanted to measure something about visibility, and it was important that the collaborative was visible throughout the trust. And this was a challenge in such a large geographically dispersed community NHS trust like CLCH. But Elizabeth Hale, who we've mentioned, who is our Director of Improvement and who sponsored the collaborative, was very supportive here. And we've got a picture here of the boards outside the executive team offices. Elizabeth really wanted these to be visible there, and she got lots of questions from board members and the executive team about what they were reading on those boards. And of course, we did lots of communications, for example, through our hub, like our internal internet system, and also just with teams reporting on their projects through their governance processes within their own divisions helped to get the word out as well. And there was a positive feeling about it in the trust. Measurement. So some of you may be wondering about measurement, and if you work in QI, definitely will be. So we really wanted an outcome measure for the whole collaborative, and we found a system level measure for joint work that's recommended by the IHI. We adapted it for our context. It consists of 16 questions, which covered psychological safety, team working, burnout and workload. So we shared this online survey with everyone on the collaborative, and we encouraged them to share it with their home team as well. So what we ended up with was 211 responses. Some of the notable results, because I won't bore you by going through the 16 different charts that we got, there were 80% of participants reported working in very busy areas. So that is hectic, very busy or busy. 36% were feeling stressed at work. So that's 36% who agreed or strongly agreed with that statement. And 39% reported not having enough time to complete their work. So we wanted to repeat this measure midway through the collaborative, and at the end we did get some teams doing the midway assessment, but no teams did it at the end. So I think what we learnt was it was a really useful baseline for the collaborative and for teams, and by doing the questionnaire they gained some insight into some areas then that they might work on through their joint work projects. So the celebration event, as I've mentioned, was very enjoyable. I do have a link to a short video that we made, which I'll share at the end of my section. Feel free to go and have a look. It's on YouTube, I believe. And what we did during this session was we had an award for every team. So we asked all the improvement coaches to come up with an award and an explanation for why. So every single team got an award and hopefully felt special, and we kept it a surprise. We had a poster competition, so we supported every team to create posters talking about their journey so far. And it was really important to emphasize it's your journey so far, because a lot of people equate posters to a finished project. So we had the competition, we asked the executive team to vote, and the winner received a choice of 3 prizes. We had some runners up as well who got certificates, and everyone who finished the collaborative, as I said, got their QI practitioner certificates, which is one of our levels of training at CLCH, and they got a badge as well, a nice silver badge. And Liz, I don't know if you've got yours yet. I'm not sure if they've gone out yet. You have, okay, great. So going back to measurement, I probably put these in the wrong order. Apologies for that. We also, I mean, we did a number of things, qualitative measures. We had a feedback questionnaire, but just something that's worthy to share with you is we asked teams what were their sort of greatest accomplishments of participating in the collaborative, and we asked them in the last learning set that we have. And you can see here what jumps out immediately is teamwork. So the biggest theme was really around engaging colleagues and learning how to work collaboratively and as a team. The other thing that comes out was it was a very positive experience for people on the collaborative, and they enjoyed having a vision and hope for change. And we did try very hard to make it a fun experience. So we used music, you know, during the breaks and the learning sets, and every team had a team name and they chose a theme song, and that made up our sort of our DJ list, if you like, for the collaborative. So yeah, we made it fun, and we did get feedback that it was appreciated how I guess approachable and laid back we were in the QI team and the delivery team. One more bit of feedback, some qualitative feedback. So we asked in a survey, what have teams enjoyed the most? So I can let you read through them, but top left is the feeling of working on something together for the good of us all, and to have support from outside our immediate service. Having designated and protected time was really important, and I think one of the real benefits of the Improvement Collaborative was that it gives teams the designated and protected time and the structure to work on something important to them. Working collaboratively and team working, as we saw in the word cloud, and working with and getting to know other people in their team and across CLCH, which wouldn't normally happen, and especially in such a large community NHS trust. So lessons learned, and this is my last slide before I hand over to Liz. A number of things. First obvious one for us was that running a virtual collaborative was very resource intensive for us. We should perhaps think about how to do it with less resources next time, but we pretty much had our whole team, especially at the beginning, learning sets, so the whole day sets, to manage breakout rooms, to manage people who were struggling with the technology. I'm sure some of you can identify this in using the virtual whiteboard. So we use Mural, and we're using those in our breakout rooms. So this links to the second point as well, is that there was variable staff confidence in using the technology that we were using to deliver the collaborative, and next time we will offer some support sessions before the collaborative starts. We felt that the 6-month period was about right. And with the coaching support, the teams who made it through the collaborative did remain engaged, and most of them remain engaged to this day. We felt it's really important to have that support and endorsement at director level from SRO, so in our case Elizabeth, the Director of Improvement, and it's important for sponsors for the individual projects to join the learning sets, as well as the improvement coaches, so that everyone is working together to support the project teams on what they're learning and what they're trying to apply throughout the collaborative. So the teams, something I was worried about was that we didn't offer the sponsors an awful lot of training or support. They were, of course, invited to the learning sets, and we sent out a how-to guide. So I was concerned that maybe teams wouldn't find that sponsored support very useful, but the feedback was that they did. So that was encouraging. And the last thing we'd say is ending with this celebration event is a must, and it really ties into, you know, the culture of QI and celebrating success, but also the join work framework, where you know, acknowledging people's efforts and work is really important. So that's it from me. I don't know if there's been any questions. I'll have a look at the chat now. So I'm going to hand over to Liz. We've got just about time for you, Liz. Do you want to take over? Do you know how to do that, Liz? And Liz was on the collaborative. She was a team on the collaborative, so we asked her just to share her experience of it.
So, thank you so much, Lou. So our team was an early years speech and language therapy team of SLTs and SLT assistants. We are from the 3 inner London boroughs of London, so Hammersmith and Fulham, Kensington and Chelsea and Westminster. And we've got a caseload size of over 1,000 children. And what we found during the pandemic was that we ended up going to agile working, so that we were remote, and people were quite isolated working at home, and that we were redeployed twice, which had quite an impact. Even though they weren't for long periods of time, it had quite an impact on shutting down the service and picking it up again afterwards. So this took us a really long time. So even before COVID, the waiting lists were quite long. But what happened was that after COVID, after we set up our services again, what we found was that waiting times between being seen for assessment and then being picked up for the children after they'd been seen for assessment had got even longer. And often the SLTs who were working with the families felt quite bad about that families had to wait such a long time as well, which was one of the things I think that sort of impacted our service. But the pandemic did, and it still does actually, had quite an impact on the amount of cancellations and children who have not been brought to appointments. So at the moment, we're calculating that probably about 30% of our children of appointments are not attended for both those reasons. So actually, and I was talking to our QI coach yesterday about this and saying that's a kind of QI project in itself that we really kind of need to go back and look at. And the pandemic has also impacted on the circumstances of children and families. So now we are seeing children coming into clinic who have grown up during the pandemic, and family circumstances have obviously changed as well. So there's lots of things I think that really have had an impact on us in terms of how we've been working. And what we found with remote working was that that the speech and language therapists became a lot more accessible to families. So there was a lot more contact via email, telephone calls than there had been when we were working in the clinics. And the kind of boundaries felt like they shifted a little bit in terms of accessibility. Which again, I think probably impacted on the numbers of children that haven't been brought to appointments. So when we took the survey initially, about almost a year ago, we asked those questions about what matters to us and what were the pebbles in the in our shoes. And actually what we found was that we did have a good team, and that people did feel supported and that they were in a safe environment. And actually within our team, we had good psychological safety. We had set up extra support for people, knowing that they were working independently, more supervision. We already had sort of like coffee kind of catch-ups during the week and things like that. So people were feeling quite supported in terms of being part of the team. But they felt overwhelmed by the workloads, feeling, I think that it was never ending, and so many children, and feeling really quite, I think, like I was saying, finding it quite difficult that children were having to wait a long time. And we had some changes in our service where previously we had seen children, if they had a speech and language and communication need, we kept them on our service all the time. But what we were doing, changed our service in order to try and meet the throughput of children, is to have a service where there were episodes of care. So it was quite a change in a service, so it was more of an in and out service rather than a service that sort of continued. And we also recognised that there was just lots and lots of admin tasks, and that was really taking up a lot of time. So our aim, and it was, I think, from what I understand, it was one of the more the sort of bigger aims, I guess, in the collaborative, was really to increase the percentage of children seen for follow-up intervention. So after they've been seen for assessment, within 12 weeks of referral, to 50% in the early years service. So when we started, it really was at 0%. We weren't seeing children within 12 weeks, and that's what we really wanted to do. And that really fitted in actually with our vision for the service as well. So it was really good timing to have the support from the collaborative to think about this anyway. So although it wasn't an aim around well-being, we felt that the well-being would come through the staff members feeling that they were seeing children more quickly, and that there was a quicker turnaround in terms of this children and families being seen. So the things that we were hoping to achieve was for families to be seen quicker in the specialist service, for staff to feel more joy at work because they felt their caseloads were more manageable. So lots of people had children, you could see on your caseload when they were coming up red that they had been waiting a long time, and that was quite stressful for people, having long waiting times. But we also wanted to have a more robust, universal and targeted service to support our in and out model that I described. So having an episode of care rather than being seen all the time. And some of the SLTs felt that they would be more confident in discharging families into universal and targeted services if there was a more robust service. We also wanted the administrative tasks to be reduced to enable more clinical time, and really for staff to feel clearer on their boundaries with service users, which I've already talked about. I think that we found that quite difficult, particularly with the complexity of what families were facing in terms of their what was happening to them every day in their lives, and actually thinking about, was there somebody better placed to meet a family's needs than the specialist speech and language therapy service? So we had a number of change ideas, and I won't go into them all in any detail, but you can have a look through them. So they were kind of broadly in 3 areas. One was about having more efficient administrative processes. One was about how do we view and communicate about our service, because some of the SLTs we didn't really feel very confident about having conversations with families about the in and out service. Perhaps they didn't feel so confident themselves in discharging children into the universal and targeted services. And then another other change of idea was really around strengthening the universal service that we were offering, and that fitted in very much at the time with the ICP priorities about having a whole systems approach to children with speech and language and communication needs. So we kind of picked different areas and really kind of looked at those things in more detail. So just some examples of things that we did is that we got a project manager to come in and to look at how long it was taking us to do admin tasks, and to see if there was any way that we could reduce that. We wanted to look at different ways for families to be able to book appointments. So we were looking at things like perhaps using Eventbrite to book onto training, because people, it was taking a long time to book people onto to courses, to appointments, and we're looking at using doctor as well in terms of sort of moving forward, and really making sure that people felt confident in terms of the policies. So we looked at report writing and how we could change that. We also identified that perhaps we needed some training to support us in feeling confident around boundaries and about taking risks, really. And so we had some training from NHS Elect, which was really helpful in thinking about conversations, how and thinking about our role, and that was really really helpful. And we started using some videos, because one of the things that we recognised is that we were trying to get the message out to all our stakeholders about our service, but when we were sending out information via email or via a newsletter, we weren't really, I think people had so many emails, so much information given to them that we that they weren't necessarily able to access that information. So we started to use some short TikTok videos, and I'll put a link into the chat just to give you some examples of some of the TikTok videos that we made. So we started off, we made a TikTok video. The first one is the one I've put in the chat. We made that for the team around the results of our survey and what we were going to be doing in Joy at Work, and we got really good feedback from that. And then we've made another TikTok video about our in and out service to practitioners to try and get them to access training. And then we have increased the use of TikTok videos, so to use them with parents and carers to get to give them information about supporting their child. So the other thing we wanted to do was to strengthen the universal service, and we wanted to get more people coming on the early years training, so we were using the TikTok videos to try and engage practitioners in attending the training, and really looking at our resources, so developing a communication hub website, which we did with the local authority, but really wanting to develop our social media presence, and to make videos, so to co-produce some films, information for families. So I think some of the things that have come out for us as our service is that we have been really well supported by the team at the QI team, and I think that has made a real difference. So we've kind of learned about using PDSA cycles and really thinking about things that we wanted to adopt, adapt and abandon, and that's been really helpful, that we've started to do things and we've kind of reviewed them and thought, oh, actually no, that really didn't work. And there's other things that we have looked at and then we've reviewed them and adapted them and are using them more. So we started off some online groups to see children more quickly. We're still not able at the moment to run groups face to face. So that was something that we did, and we wanted that was something to support the joy in work, because it enabled the therapists to work together rather than working independently. We felt that we really needed a focus on what we wanted to change, and I think just having outside support just made all the difference, and just having patience and time. So our aim is ongoing. It's ongoing until August, but actually I think it will be ongoing you know, past August, to be honest. I think it's something that it's going to take us a while, definitely. What we recognised though for our Joy in Work team, so there was just a small group of us that were doing it. It really increased our immediate team's joy at work, but what we felt was that it wasn't immediately, because the changes are sort of going to take quite a long time to happen. It didn't immediately have an impact on the wider team, so we recognised that we might need to do something else to support sort of health and well-being alongside this joy at work. So we've kind of got a little splinter group who are looking at health and well-being within the team. So I think that we recognised that it was great for us because we were all very excited, and we were doing all this kind of really interesting work, but it didn't necessarily have such an impact outside of that. So what we got from it, we got some changes in our service. We got a logo, so we're really looking at the branding of our service. So the logo is the communication station. We spent time with parents and with students, looking at what we wanted to be called and what the logo would look like. We've had this training from NHS Select. We've had project management support. As part of Joy in Work, I put in an application for charitable funds and got quite a lot of money to get trained to use some social to train us to make short videos. But I think for me and for the rest of the team, what has been the most useful is having kind of, we had weekly sessions with our QI coach, and that has really made a difference to us. I think it was about the impetus to keep going, and that he has supported us through the collaborative and continues to support us, and through that we've had access to other teams as well. So it has been a very, very positive experience for us as a team. So thank you.